So now we're going to move to nutrition and eating segment, and let's talk about a few things related to nutrition. So what are some indicators that we can measure that would show us our aspects related to our patient's nutrition? There are certain labs that can definitely tell us about our patient's nutrition and most recent nutrition. That's like albumin and pre-albumin labs, but also things like anthropometrics. So anthropometrics are things like their height, their weight, basics, their BMI, and basics like that. So BMI stands for body mass index, and how you calculate that is it's the patient's weight in kilograms divided by their height in meters squared. And the BMI gives us a number where if it's within a certain range, can tell us kind of their status. Are they normal? Are they at risk for being obese? Are they obese? And you want your BMI, you want your patient's BMI to be less than 25, but not, I think 19 to 25 is the good range. Because if it's below 19, then you're concerned with like emaciation, but above 25, you're concerned with being overweight. So, but granted, the body mass index does not specify between muscle mass versus fat mass. So if you have a super muscular patient, their BMI is going to be high, but you also just have to use your nursing judgment and common sense with that. So when a patient is eating, ideally they will go to a specific location, especially in our like assisted living facilities, for eating, just to help promote like social interaction, get them up and out of their room, help them maintain a routine. So we'll talk about transfers in a minute, but if the patient can, they should be getting out of their room to eat, promote that social interaction. So let's say we're gonna position the patient. If they couldn't go out to eat, like for some reason or another, into the dining area, we're gonna position them appropriately. I would place them in the high Fowler's position. And like I said, we'll explain the patient positioning terms in a minute. But you can bring their food cart over, and you want to promote all the independence that they have. So maybe the only problem they have are visual deficits. So you'll bring the plate over, and then you can explain to them like a clock. At 12 o'clock you have your mashed potatoes, at 3 o'clock you have your peas, at 6 o'clock you have your Jello, and at 9 o'clock you have your turkey sandwich. And then that way they can orient themselves to their own plate, and if it's only a visual deficit, then you've just oriented them to what they're eating and they can feed themselves. You want to promote that independence. Secondly, maybe it's not visual, but they have a hard time with their fine motor movements with eating. So what you can do with that is they have different types of silverware, like adaptive silverware that might have a large handle or a large like fork area or spoon area that allows the patient to be able to continue to feed themselves, promote that independence, but it's just slightly adapted for them. Let's see. And then we'll talk about dietary modifications in a minute, but let's say they need help. You want to promote independence, ask them what they would like to eat if they can verbalize, and then you want to be at the same level as the patient. You don't want to be overtowering them, and you want to be able to make sure you can take your time with the patient. That way they can eat adequately and not feel rushed, and also promote that independence by letting them choose what they want to eat in that moment. And then obviously you want to make sure that you're following any dietary modifications that the patient has. So what do I mean by that? those are the type of diets that a patient might have. Like you've heard, like a pureed diet, maybe a regular diet, um, a thickened liquid diet. So I'll explain to you some of these things, the different types. So you can have a clear liquid diet, which is like broth, coffee, tea, carbonated beverages, water, gelatin, and popsicles. Anything that once it's in the system would be clear. Note that coffee is considered a clear liquid. Full liquid diet would just be everything that is a liquid at room temperature. That includes custards, vegetable juice, fruit juices, and all the clear liquids. Pureed diet includes things like scrambled eggs, the soft stuff, pureed meats, vegetables, fruits, as well as mashed potatoes and gravy. Mechanical soft, which is like cheeses, pancakes, light breads, cooked vegetables, canned fruits, bananas, soups, and peanut butter. And a regular diet, which has no restrictions. You have a soft, low residue, which means like a low fiber diet. This is pastas, casseroles, canned or cooked fruits and vegetables, stuff like that. And high fiber, things high in fiber. And modified fluid consistency. So this is for, often you'll see this as a speech therapy note. The speech therapist has the education to evaluate the patient and then determine what type of liquid diet or what consistency diet that they need. So you can have a nectar thick, which they need it just slightly thicker so they don't aspirate, or a honey thick, so that it's not, so they don't aspirate it, but they need it to be thicker than nectar. And a lot of times they have little powders that you can reconstitute your fluid with that you're going to give the patient. So if it was apple juice, you want them to, based on how much they want to drink, you'll add that many gel mixes or whatever they use at your facility, shake it up, and then you can administer it to the patient. But be sure you're following those, because that's an aspiration risk if you do not. Even when administering medications, you need to make sure, like if it's a liquid medication, that it's thickened as well, so that they don't aspirate. So just a few other things with nutrition. Let's see. When we talked about kind of our nutritional assessment, you can ask the patient what their preferences are for food, any unpleasant symptoms, like if they have acid reflux or anything like that, allergies, if they have any difficulty with chewing or swallowing, changes in appetite or in weight, and any medications that could cause them to adjust in what they're liking to eat. Especially, I also want to think of any dentition problems, like maybe they have a really sore tooth, or they have dentures, which makes it harder for them to eat. So I'd also assess for that. All right, that's it for nutrition. We're going to go to personal protective equipment and hand hygiene.